Hi, I'm Dr. Tiffany Lester, a board-certified integrative medicine doctor. Our current paradigm for health is to treat the symptoms and not the whole person. We have a system that is currently fragmented into all of these different silos of care with a doctor for every body system, like lung, gut, heart, etc., which is amazing if you need a specialist in that area. For most chronic conditions, though, the root cause is interconnected when our healthcare systems are not. They aren't very efficient at talking to each other, and so much of that burden falls on the patient to connect all the dots. This ideally should be the role of the primary care doctor, but they are often overburdened and are not set up for success. To really get to the root cause of diabetes or high cholesterol or autoimmune conditions takes time, and so patients receive Band-Aid fixes. I believe the other reason is that we don't learn in medical school how to treat the whole person, and you have to seek out additional training in nutrition, for example, to help people achieve optimal health. So what steps can healthcare providers take to reduce the risk of misdiagnosis? It goes back to time, as I mentioned previously. Time to spend with patients and really get to know them. Time to stay up to date on all the latest research when you are already working long hours. Time for clinicians to care for themselves and refill their own cup so they can continue to provide excellent care. How can a misdiagnosis affect a patient's health and treatment? I would love if clinicians were more careful before assigning a diagnosis to a patient. Labels can have a profound impact on someone's emotional and mental health. For some, it can be validating to finally have a name for how they've been feeling. For others, it can put them in a box, and other diagnoses might be missed or delayed. I try to be very mindful before diagnosing someone, as it is easy to get boxed in and miss getting to the actual root cause of the health concern. Trust is important in patient communication and preventing misdiagnosis. You first have to be able to trust that you will be seen and heard by your clinician to share your full story, which is vulnerable and can be tough to do for someone you literally just met. Once your clinician knows, though, your entire story, then they can start to put the pieces of the puzzle together for an accurate diagnosis of your current health status. Here are some tips for patients to advocate for themselves and prevent misdiagnosis or wrong prescriptions. 1, try to find a doctor that looks like you or has a similar cultural background. Research has shown that this improves health outcomes and patients are more likely to follow recommendations. This isn't always possible given the lack of diversity in healthcare, but do your best. 2, come with a list of questions. Appointment time is a finite resource and it is so easy to forget important details. If you are able to send a note to your clinician beforehand so the visit stays focused and you get your needs met, even better. 3, bring a trusted friend or family member as an advocate. They may remember details of your health history that you have forgotten and serve as a support if you feel like your concerns are not being adequately addressed. I hope you learned a little bit today about integrative or functional medicine and it piqued your interest to learn more. If you really want to dive deeper and feel like you need more support in some of the things that we talked about, then you can find me on Instagram at Dr. Tiffany Lester, or if you want to sign up for your own personal consultation, you can find me on my website at drtiffanylester.com.